Assalamu alaikum. Good evening for everybody. We are in the half of month of Ramadan. I hope Allah subhanahu wa ta'ala accept our fasting and our prayer. I want first of all to thank the postgrad in National Guard to arranging this event. The attendees, mashallah, reaching the upper maximum. And there is a lot of people attending with us today. I want to thank the attendees with us today that take from their time from prayer and from fasting to be with us today in this lecture. Today I will share with you the management of diabetes during month of Ramadan and what we should do and what we shouldn't do, and when we should break the fasting and we shouldn't not break the fasting, and what we should tell our patient and we shouldn't tell our patient. Also, I want to announce very important things, that the certificate, it will be, the certificate, it will be there is attendance link of this course. It will be announced and published at the end of this session for your check-in to order to receive your certification and CME hours. So please be with us till the end of the lecture. And the certificate to work in the link, we give you the link to facilitate your CME hours and your certificate. Second thing, we will share with you also all the aspects related to the diabetes management during month of Ramadan. So please be with us in whole lectures. The agenda today, I will start with a small introduction, then about Islamic view of fasting during month of Ramadan, because you know the Islamic scholars, they are very important, like the doctors in treating fasting patient. Because if the Islamic scholars or sheikh, he said no, you should fast, and doctor he said you didn't fast, or vice versa, the patient didn't know who to follow. Then we will give you a small introduction, how many people fasting Ramadan worldwide, then what's happening as a pathophysiology of fasting. Then they will take the major risk factor associated with fasting in month of Ramadan. Then I will share with you the general guidelines management of type 2 diabetes and type 1 diabetes during month of Ramadan. Then after that, we will have the summary. If you have any question, please put it in the box of Q&A. Then at the end of lecture, maybe we can share it with each other, or if you want to take the mic and ask a question by yourself, or also it will be allowed. So the introduction, there is more than 100 million Muslims worldwide are estimated to have type 2 diabetes. As you know, the worldwide Muslim is 1.6 millions, and 23% of those population, they having 23% of the global population, the Muslims. 8.8% their age from 20 to 80s, and they estimated to having diabetes. So 90% of them, they having type 2 diabetes. So for sure, more than 100 millions of Muslims worldwide fasting month of Ramadan. If we try to focus about religious fasting, the religious fasting, we will talk about from scholars, Islamic scholar aspect, that ill patients are extremely from fasting. They are allowed to they are allowed not fast, but you know it's multifactorial. It's religious, cultural, and social reasons. Sometimes even if the doctor told you don't fast, you want to be fast, and we as a doctor, we should respect the patient desire. So we try to help them. We told them, for example, you are low risk or moderate risk or high risk, but if you are even high risk, we try to help you to fasting month of Ramadan safely. So almost 80% of the people with type 2 diabetes fasting during the month of Ramadan, and more than 40% of them, they are type 1, and also they fasting month of Ramadan. However, we told them you are higher risk. So the relation between healthcare provider and religious leaders is very important to deliver the same message regarding the patient. He shouldn't fast. If, for example, me as a physician, I told my patient, please, you don't fast, but the religious leader said, no, you should fast, then the patient, he will not know what to follow. but it's a discussion between us and them, and we try to create and tell our religious leaders that this is the Islamic view, and this is the I mean, from medicine point of view, the higher risk, and this is the religious point of view. So I try to share with you what's the Islamic view about diabetes. It's not my opinion. This is by I mean, Hayat Kibar al-Ulama, so they are the one to answer the question. I will start with this question. This question in Arabic. Maybe some of you didn't know Arabic, so I will try to translate it. There is patient, he said, I am diabetic since 3 years, and I can fast Ramadan, but it is very difficult for me. So can I breaking the fasting or not fast this year? If I am not fasting, what should I do later on if I want to, I mean, to compensate these days? So the Islamic view said if you cannot fast Ramadan, so you can, or you are, I mean, you are very sick, or you are traveling, you have long, I mean, travel, as you know, some of the traveling, I mean, reaching 24-hour or more, and if you cannot do it, so you can do it later on, and if you can compensate it later on, that's good. If not, you can give a food for those, I mean, for those very poor Muslims. So just this is the way to not, I mean, to compensate this. Other question is also asked to the doctor, if I take my long-acting insulins during fasting hour, is this breaking the fast or not? So the answer is by those Islamic scholars, no, this is not break down the fasting. Other question is, I am 72 years old. I am sometimes forgetting in the prayer. And also if I'm doing fasting, this will affect my mentation. So can I not fasting Ramadan? The answer is not by me also, it's by those Islamic scholar. And this is the name of the, Sheikh Abdulaziz bin Baz and his group. They said, yes, if you cannot fast, you didn't fast, please, and this is maybe make you more sick. So please do it later on or give the food for poor patients, poor people. Other question again about insulins. Is this insulins break down the fasting? The answer by Sheikh Abdulaziz bin Baz and his group that you are not, this is not break down the fasting. So what's the problem with fasting Ramadan? Why we are trying to tell the patient you should fast or you shouldn't fast? There is 4 major problems usually during month of Ramadan. One of them is severe hypoglycemia. In type 2 diabetes patient, there is increase about 7.5 to having hypoglycemia during month of Ramadan. And there is 5 times severe hyperglycemia risk, it will be increased, and sometimes diabetic ketoacidosis in those patients of type 1 diabetes. And although, as you know, during very long fasting hours like nowadays, reaching 14 hours, there will be dehydration. And other point is thrombosis. So the thrombosis is the 4th major risk factor also if you are planning to fast in Ramadan. So in DAR study by Dr. Hassanein and his group, this published in April 2016, they tried to take the patient and try to define their risk of hypoglycemia. And as I told you, the risk is increasing as I show you here. Here, it's 7.5 increasing if you compare pre-Ramadan during month of Ramadan. And again, the risk of hyperglycemia also 5 times increased during month of Ramadan. As you know, after iftar, especially the hyperglycemia try to be shooting up. Okay, what about sleep? Is the sleep change during month of Ramadan? The answer is yes. You know, our sleep time is changing during month of Ramadan. Usually in the regular days, we sleeping at 9, 10, 11. But during month of Ramadan, most of us will not sleep unless 4 or 5 p.m. after Fajr prayer. Then after that, you'll sleep a little bit, then you wake up for work, then come back, sleep again. So the sleep disturbance during month of Ramadan and the total sleep time is decreased, as you know. And there is delay in sleep. If you are in regular times, you sleep by 9 or 10 or 11. During month of Ramadan, you sleep 3 and 4 and 5. And for sure, there is decrease in REM sleep duration, as you know, and there is decreased proportion of REM sleep, and there is increased proportion of non-REM sleep. That's why will happen to us. You sleep, then after 2 to 3 hours, you wake up, then sleep again, then wake up, then sleep again, and wake up, and so on. And for sure, this situation, it will be make your fasting, make your blood sugar also fluctuating, especially if your patient having diabetes. So usually what's happening after iftar, most of us, especially also those patients with diabetes, they will be hypoglycemia a little bit before iftar, but after iftar, it will be shooting up, then come down again, then after suhoor or a time of suhoor will shooting up again. So we should take care in our consideration of our patient fasting Ramadan about these situations, that his fluctuation in his blood sugar. I think also at suhoor time, most of the patient, they will eat very rich meals like rice and meat and chicken like this. Some of them, they will put some sweets with or an add to. So at time of suhoor, and as you know, this is will shooting up the blood sugar. Usually, but not this like this year. In previous Ramadans, the people having sometime social gathering, and there is a lot of food like this picture during fasting or suhoor, and there is blood sugar will be shooting. I mean, thanks God this year, maybe the social distance play a role during this month. What about the children? Also the children during month of Ramadan or non-month of Ramadan, if you ask them what's your first choice, they will choose fast food. As you know, fast food, it will having very high carb meals, and it will shooting the blood sugar. Okay, so in hemoglobin A1C of our patient, sometimes the hemoglobin A1C is not only the main value to check the blood sugar, because I will show you some slides. This is Fahad. His hemoglobin A1C 7.1, and his mean blood sugar 145, the standard deviation 43. So his blood sugar is up and down, but within normal range, and this is good and desired. But if we try to check Sarah, she's also 7.1 hemoglobin A1C, but the mean of blood sugar almost the same, but the standard deviation is 94. So as I show you here, shooting up, then shooting down, then shooting up, and shooting down. So this patient, if we calculate hemoglobin A1C only, we can say this hemoglobin A1C is normal. But if we try to check the blood sugar reading, it's up and down. So the hemoglobin A1C, it's not the only factor to check the blood sugar. Also ask your patient to check their blood sugar fasting and 2 hour postprandial and in between. And I will show you also during month of Ramadan how many times we should and when we should check the blood sugar. So if we take the patient, and there is multifactorial actually between diabetic patient and between the disease and the patient influence the risk of hypoglycemia or hyperglycemia or other risk factor during month of Ramadan. One of them is type of diabetes. Type 1 is different than type 2. Type 1 is very high risk. Type 2 is low risk and depend on their stage and depend on their medication. One of the most important questions you should ask your patient previous Ramadan experience. What did you do during previous Ramadan? Did you do it well? There is any hypoglycemia? Did you break down your fasting before, or everything is going smoothly? Again, in individual social circumstances. I know some of the people, they are very socialized, or their work depend of them to be more socialized, and they having a lot of social gatherings. So the food is very important here. Work circumstances. Some of the patient, they have very severe hard work, hard labor work. So their work is very hard. It's need huge physical activities, and this is tell us the risk about hypoglycemia or the risk of fasting the Ramadan, fasting patient, diabetic patient during month of Ramadan. And there's, as you know, there is individual hypoglycemic risk between patient to other patient. The presence of presence of complication and comorbidities. Patient with diabetes alone, it's not like patient with other comorbidities like renal failure, heart failure, or other comorbidities. So it's depend on their risk factors. Patient medication, if the patient having 1, 2, 3, patient in insulin or non-insulin, patient in oral, non-oral, it will be different on management. So what's happening? What's the pathophysiology of fasting? What's happening to our patient? It's, as you know, transition from fed state through brief fasting and into prolonged starvation is mediated by serious complex metabolic, hormonal, and glycoregulation mechanism. And it's divided in 3 stages actually. Post-absorptive phase, it takes from us 6 to 24 hours after beginning of fasting. Gluconeogenesis phase, it will take from us 2 to 10 days of fasting, and the protein conservation phase beyond 10 days of fasting. That's why when we start early days of Ramadan, we feel our body like hunger during fasting, but later on, like what we are now in the middle of Ramadan, we don't feel we are so hunger like the previous days. Our body try to accommodate and try to having memories to accommodate the fasting month of Ramadan, and we take enough food at suhoor time. So we make our sleep sometimes in non-fasting, in fasting hours. So the mechanism of fasting change between the first days of Ramadan till the middle or end days of Ramadan. So this is a study by Dr. Hassanin and his group. It's published in 2016, and there is a lot of recommendation. Actually, we'll go through it as a practical guidelines. So they define the patient in 3 categories. Very high risk group. Those patients shouldn't, this is very high risk group, they shouldn't fast Ramadan. There is high risk group, we prefer them to don't fast Ramadan. Moderate to risk patient group, they can fast Ramadan easily. So who shouldn't fast Ramadan? The category number 1, those very high risk. Those patients severely hypoglycemia within 3 months prior to Ramadan. Those with diabetic ketoacidosis within 3 months prior to Ramadan. Those with hyperosmolar hypoglycemia coma within 3 months prior to Ramadan. Those with history of recurrent hypoglycemia. Those with history of hypoglycemia and awareness. Those with poorly controlled type 1 diabetes. Those with acute illness. During acute illness, we don't recommend the patient to fast Ramadan. Those with pregnancy and pre-existing diabetes or GDM treated with insulins, and some countries still using sulfonylurea. Those with chronic dialysis or chronic kidney disease, stage 4 and stage 5, very dangerous to fast Ramadan. Advanced macrovascular complication, also we don't recommend them to fast Ramadan. Those old age with ill health, we don't recommend them to fast Ramadan. Category number 2, those high risk. Those we told them you shouldn't fast or better not fast. So one of the following, they are, we call them as a high risk. Type 2 diabetes with sustained poor glycemic control, will control type 1, will control type 2 in multiple dose insulins or mixed insulins, pregnant type 2 or GDM corrected by diet only or metformin. GDM, that's mean gestational diabetes mellitus. Chronic kidney disease stage 3, stable macrovascular complication, comorbid condition that present additional factor, intensive physical labor, like some jobs, treatment with a drug that may affect cognitive functioning. So what's the patient they allow to fast Ramadan? Those patients allowed to fast Ramadan having one or more of the following: lifestyle therapy, metformin, acarbose, TZDs, second generation sulfonylurea, incretin-based therapy, SGL2, basal insulins, those allowed to fast Ramadan. So again, we'll show it to you. Category number 1, those very high risk must not fast. Those category 2, they are higher risk but should not fast. Category number 3, they can fast Ramadan smoothly without any problem. However, all of these categories we discussed with Islamic scholar, and the Islamic scholar said if those patients there is high probability of harm, please tell them not to be fast. So the individual management of diabetes during month Ramadan, it's 3 stages actually. The one, it's before Ramadan, assessment. So put your patient as a category, create individual management plan for each and single one of them, provide advice on self-management. The second thing, like nowadays, individualized management plan during month of Ramadan. So we create nutritional plan for them. We adjust the medication, I will show you in the next slides, and performing SMBG, that's mean frequent blood sugar monitoring, and post-Ramadan follow-up to adjust the medication again or readjust the regimen again and tell them what to do. So frequent blood glucose monitoring during days of Ramadan is very recommended. So as you know, in the morning, if the patient wake up in the morning, mid of the day, then mid-afternoon, then after iftar time, then 2 hours after iftar time, then pre-suhoor and so on. Continuous glucose monitoring is a key point during month of Ramadan. Here, as I show you before, during iftar time, there is shooting up. During suhoor time, also shooting up, and so on. So usually we advise frequent monitoring. This is just a simple slide to show how much we should check. This is the starting morning, then at the middle of the day, then this here in noon time, then afternoon time, sunset time, then evening time, 2 hours after, 2 hours after breakfast, and so on. So it's like continuous monitoring should be checked at any time. Also, there is in between you should check when your hypoglycemia is recognized. If the patient feeling his hypoglycemia, he should check and document it because it helps us to tell him when you should break down the fasting. So general rules, pre-Ramadan education for physician and the patient is very important. It's personal decision at the end. We are, as a physician, we told our patient, this is the guidelines and this is what we recommend for you. But as you know, if you told them high risk and he want to fast Ramadan, we should respect his decision and we try to help him to adjustment his management plan with each and different kind of patient. Frequent monitoring of hypoglycemia also is very important, as I showed you before. Avoid common practice of ingest large amount of food rich in carbohydrate at iftar time. And try to make the suhoor as late as you can. And by the way, this recommendation also by Prophet Muhammad ﷺ, to make iftar earlier and to make suhoor as late as you can. Try to encourage fluid intake increase during non-fasting hours as much as you can. Normal level of physical activity must be maintained. I will talk about it also later on. Excessive physical activity should be avoided, especially during fasting hours. Taraweeh prayer, some of the patient doing Taraweeh prayer, please, if you do it, calculate it from your daily exercise program. So the Taraweeh is, yes, it's daily exercise program. Please calculate it from your daily exercise program. So if some of the patient will ask us, doctors, when the exact time I should make my exercise? We told our patient, please try to avoid exercise during fasting hours. And please, the best time to make your exercise is 2 hours after fasting. And please check your blood sugar before exercise. And please check it at the middle of exercise and at the end of the exercise to prevent hypoglycemia. So the other question, it came to us when I should break down my fasting, regardless of the time. So we told our patient, if your blood sugar is less than 60 at any time of the day, even if it's 1 hour or half an hour or 15 minutes, please break down the fasting. If the blood sugar less than 70 during early hour of the day, please break down the fasting. If the blood sugar exceeding 300 milligram at any time of the day, also you should break down your fasting. If you are severely sick, like patient having severely dehydration, diarrhea, vomiting, also you should break very high sky high fever, you should break down your fasting. What about type 2 diabetes in Ramadan? There are many categories. We will go through them. We have patient diet control patient. We have people in insulin sensitizer like metformin, or bioglutazones or glutazones. There is patient on alpha glucosidase inhibitor. There is patient in incretin-based therapy. We mean by incretin-based therapy those in DDP4 or GLP-1. There is patient in short-acting insulin secretogenesis. There is patient in sulfonylurea, and there is patient in insulins and insulin pump, and there is patient on SGLT2 inhibitors. I will go through all of them one by one. So those patients in diet control, we told them, okay, continue lifestyle modification with diet and exercise, and try to avoid very high carb meals. In metformin, they are safe to fast Ramadan, and if they have 3 tablets, they can take 2/3 at iftar, so 2 tablets, and 1 tablet during suhoor time. Those in glutazone, TZDs, there is no hypoglycemia per se, but you know the effect of this medication sometimes say having some concern of hypoglycemia. So if you want to start this medication, don't start it at the month of Ramadan, just do it 2 to 4 weeks before Ramadan. So again, regarding the metformin, if the patient having only 1 dose, there is no modification, it will take it at iftar time, especially for those extended release. Those patients having twice daily, they will take 1 at iftar and 1 at suhoor. There is no dose modification. Those taking 3 tablets, they will have morning dose to be taking before suhoor, and there is combined afternoon dose which will be taking at iftar time. There is prolonged release metformin. There is no dose modification adjustment. It will be taking at iftar time. Either it's once daily or twice daily. It will be taken at iftar time. Okay. So alpha glucosidase inhibitor like a carbose and others, there is no hypoglycemia in general and modest control. As you know, this class, they having gastrointestinal side effects. Some of the patients, they don't tolerate it. Usually we don't change the dose, the same dose. Sulfonylurea. Usually it's popular worldwide and it's low cost. That's why it's available anywhere and everywhere. It's suitable during Ramadan if using properly and with precautions. So usually clomiprid is contraindicated to those old generations. Given clamide and glimepiride associated with high risk of hypoglycemia among those groups. Second generations better tolerability like gliclazide, glimepiride and glipizide, those well tolerated, and I will show you some graphs it will talk about. This study is talking about hypoglycemia in sulfonylurea in general during fasting month of Ramadan. And as you show you here, this is the glimepiride, this is the gliclazide, this is glibenclamide, and this is glipizide, and this is overall. So as you see here that gliclazide, or some of you they use dimecron, is less comparing the other group in matter of symptomatic hypoglycemia during month of Ramadan. And as you know, the symptoms we're talking about sweating, tremor, palpitation, headaches, usually the regular symptoms of hypoglycemia. Again, they show you that gliclazide also the least one of them causing hypoglycemia among all the groups during month of Ramadan, and the incidence of severely hypoglycemia. Here, this is symptomatic hypoglycemia, and this one, the severely hypoglycemia. Some of them, they need medical assistant. So, glibenclamide, full dose pre-iftar, half dose pre-suhoor if the patient take 2 tablets. Gliclazide, full dose at iftar and suhoor with no dose usually adjustment. And this is just to show you, brief about what we said. The sulfonylurea during month of Ramadan, it's once daily dosing, taking at iftar time. In the patient will control, we might reduce the dose by 30%. Twice daily dosing, sulfonylurea, 1 at iftar, the same. And during the suhoor time, we decrease the dose maybe by 30%. Older drug in this class, as we said before, glibenclamide, which will carry risk of hypoglycemia, should be avoided. Second generation sulfonylurea, like gliclazide, glimepiride, should be used in preference if we should use it during month of Ramadan. So short-acting insulin secretogenesis, as you know, the glinides, it will taking pre-meals. There is no hypoglycemia. It's better than other insulin secretogenesis like glibenclamide. Also can be taken at pre-iftar and pre-suhoor without need for adjustment. Okay, What's the pharmacological management of people with type 2 diabetes? Due to low risk of hypoglycemia with bioglutazones, there is no dose modification is required during Ramadan, and dose can be taken at iftar or suhoor. There is no randomized controlled trial about acarbose and his groups in fasting diabetic patient, but there is no dose modifications necessarily because there is very small risk of hypoglycemia. The daily dose of short-acting insulin secretogenesis, it's based on 3 meals usually, but it's reduced during month of Ramadan or redistributed during month of Ramadan according to the meals. Usually we take 1 tablet, with iftar and 1 tablet with suhoor. What about GLP-1s or DDP4? Usually there is no dose adjustment. But as you know, we have multiple GLP-1s. We have exenatide, liraglutide, dulaglutide, and nowadays we have semaglutide, those once daily and once weekly medication. Usually we start them 2 to 4 weeks to start effect. So please don't start them at month of Ramadan. Please start them before that and need to do titration, as you know. The problem of this group is side effect of GI symptoms. The DDP4, as you know, we have multiple medications, Sita, Lina, Saxagliptin, Valdagliptin. It's beta tolerated, and there is no dose adjustment during month of Ramadan, so it will be taken at iftar time without dose adjustment. Some of them, they having 2 tablets per day, so 1 dose during iftar and 1 dose during suhoor. So there is no dose requirement. GLP-1 has it should be titrated 6 weeks or before month of Ramadan. But please don't do this escalation or further treatment as month of Ramadan or modification required during month of Ramadan. What about SGL2 inhibitors? We have multiple in this class. Empagliflozin, canagliflozin, dapagliflozin, and others came on, like they will be having ertugliflozin and so on. So those class group can be used with cautions with some patients, especially those with having another diuretic medication. There is a high risk of developing dehydration. So please encourage those patients to drink a lot of fluids during non-fasting hours, and please tell them to take it at iftar time. Don't initiate it during month of Ramadan, but if the patient already on it, please continue to take it during month of Ramadan. So now we will talk about those type 2 diabetic patient that's in multiple insulin regimen. Some of them, they have basal insulins only. Some of them, they having basal bolus. Some of them, they having basal with very short acting analogs. Some of them, they having pre-mixed MPH plus regular. Some of them, they are already in pre-mixed analogs, like what we call 70-50 or 50-50 or 70-30 or 70-75-25. They came in 1 pen, but it's mixed already. We will talk about it in details. So those patients in basal insulins only with oral medication, they will be continue alone, and this basal insulins, it will be taken at iftar time. And if the patient will control, please decrease the dose by 20 to 30% initially, then couple of days reassessment what's going on. Those in basal bolus, they will take long-acting insulin at iftar time, the same dose if not controlled. If they are well controlled, we might decrease the dose 20 to 30% if was only well controlled pre-Ramadan. Pre-meal insulin, the same dose, but dose distribution. As you know, pre-Ramadan, the patient have breakfast, lunch, and dinner. But during Ramadan, they will have maybe breakfast and suhoor. So distribution of the doses depend on the meals. Frequent glucose checking both the meal is very important to adjust the dose of basal insulins accordingly. Pre-mixed insulins, we have single dose. So if the patient having only 1 check per day, he will take it at iftar time. Again, if he has well-controlled pre-Ramadan, you might decrease 30% of the dose, then re-evaluate after that. What about pre-mixed insulin? Those taking twice daily. Largest dose, if he take, for example, 50 and 30, the 50 it will be taken at iftar time with no change. The lower dose, take it at suhoor, and if patient will control, try to decrease it by 30%. Type 1 is very important during the month of Ramadan. We told our patient usually you are very high risk and please don't fast Ramadan. But as you know, some of them, they will not listen to us, or they want to fast Ramadan. So we try to help them to fast safely. So we told them we need frequent glucose check several times per day, especially during fasting hour. Those may be adjusted during month of Ramadan based on the readings. So the current understanding that the basal bolus regimen is a preferred protocol for management. Frequent use option is once or twice daily injection of intermediate or long-acting insulin along with pre-meals or rapid-acting insulin. There is no mixed charge or homolog mix for type 1 diabetes, and we don't prefer the patient to take it during month of Ramadan or non-month of Ramadan. There is few study regarding the best insulin regimen during month of Ramadan, and it's running nowadays, but it's not published yet. We prefer combination. It's combination therapy, like the patient should taking long-acting insulin at iftar time and short-acting taking at the meal as we told you. The pump, continuous subcutaneous insulin infusions, is preferred and alternative option. But what's the problem with this option? It's costly, as you know. The pump will cost a lot of maybe 40 or 50,000 of reals. Availability may be not available everywhere and anywhere. Patient compliance is very important because it's needing multiple checking and multiple readings. So that's why the pump choice, maybe it's not available or not accessible for all the patients. Some of the doctor, he ask us always, doctor, how I adjust my medication during month of Ramadan? The answer about this is very simple. If your patient is well controlled, he should take, as we said, the largest dose of basal at iftar time. Reduce it by 30% if they are well controlled pre-month of Ramadan. And how you adjust? If your patient, he told you before iftar time, my blood sugar is less than 70, tell him reduce your basal insulin by 4 units. If it's from 20 to 90, reduce it by 2 units. If from 90 to 126, no change required. 126 to 200, increase by 2 units. More than 200, increase by 4 units. What about short-acting insulins? Again, it's almost the same. They should check 2 hours after, and they should having the reading post iftar and reduce the blood sugar reading accordingly. If anyone want to shoot screening for this, he can, because later on maybe he will need it in his management. He can. The insulin pump, you know, the basal rate reduced by 20 to 40% in the last 3 to 4 hours of fasting, and increase after iftar because to compensate, the fasting hours. The bolus rate is usually carb counting, so it's depend on the patient eat. Depend on his eat, he will adjust his bolus rate, and he should check it frequently. So usually, this is, just summary what we said. Before Ramadan, we should ask the risk stratifications, when to break the fasting, and when to exercise, what's the best time to exercise. So just take it like a summary. Please do risk stratification for your patient. SMBG is a key, golden key to our patient. Frequent blood glucose monitoring. When to break the fasting is very important. Should the patient know when should you break down your fasting? Also, when to exercise. The time of exercise is very important. Please don't do this exercise in fasting hours. Do it 2 hours after iftar time. Fluids and meal planning is very important. Frequent fluid injection is very important. If you drink fluids a lot, especially water, is very important. Adjust medication is also very important. Discuss with your patient the management plan. As I told you, it's individualized. Not all the patient, like each other. Please take details, history about medications and everything. Also, experience during previous Ramadans and before, very important. Patient ability to self-manage diabetes. Is he having self-management and he know how to control himself? And after all of these, please decide. Advise him not fast. You are very high risk or high risk, or allow him to fast. So you talked moderate or low risk. As I told you, it's at the end, it's a patient decision. If he said, no, I want to fast, I know you told me advice not fast, but I will fast. Frequent blood glucose monitoring is several times a day, as I show you before, is very important. Those moderate to low risk, maybe 1 to 2 times is enough. All patients should break their fasting regardless of their type of disease, if blood sugar less than 70, blood sugar more than 300, symptoms of hypoglycemia, or very acute illness occur. This is the summary of oral, what we said before. Just if any one of you want to put shoot screening, metformin if you take 3 tablets, 2/3 at iftar, 1/3 at suhoor, bioglitazone full dose at iftar, alpha carbose same doses, DDB4 same doses, GLP-1 same doses, glenide same doses, sulfonylurea it will be taking at iftar time same doses. Glibenclamide or if the patient will control, maybe we will decrease the dose little bit at suhoor time. This is the summary of insulin. If the patient in basal only, he will take it at iftar, no need for adjustment, unless it's a very controlled type 1 or type 2 diabetes prior to Ramadan. Basal bolus, basal the same dose, largest dose at iftar time of boluses, smallest dose at suhoor time. Frequent monitoring is the key point. Twice daily premix, large dose at iftar, and other suhoor to be reduced by 30%. So decreasing hemoglobin A1C is very important during fasting month of Ramadan or non-fasting month of Ramadan is very important, please. And I put this slide just to share with you, only decreasing 1 in hemoglobin A1C, it will decrease 37% in microvascular complications like kidney or eye blindness or kidney disease, and 43% amputation or fatal peripheral artery disease, and 21% death related to diabetes, 14% heart attack, and 12% stroke. Please, it's very important, very, very important to do this and try to, if you succeed to tell your patient to decrease his hemoglobin A1C only by 1%, for example, his 10 you make it 9 or 9 you make it 8, is very important for us. Only 1% it will develop a huge decrease in complications. Take home message now, and we will take after that the questions in Q&A, then we can make you to take the mic and ask a question. Take home message. Nothing fixed, but everything is individualized. The patient is not the same. Pre-Ramadan education for physician and the patient is first step to achieving the goals. Frequent monitoring and titration by the patient himself or herself is the golden key. Always ask for help. Thank you so much, and we will take your question.
Thank you, Dr. Raed. Thank you. Dr. Raed, you would like to publish all the questions, or you would like to receive it in voice?
Okay, so you can, if you read it, just tell me and I can answer it one by one.
Okay, I'm waiting the questions. For anybody who has any question, please write it so I can publish it for Dr. Raed. Thank you.
So we will start with a written one, then we will start with voice one. What do you think?
Up to you, Doctor. Up to you.
Yeah.
So we have only one question right now published already.
Okay, go ahead. Okay, sometimes they said sometimes we ask the patient to monitor his glycemia with each time of salat. Is it correct? Actually, don't put it with salat. Actually, tell your patient, please do your blood sugar monitoring 2 hours after the meal and at iftar time. This is the best way to check the blood sugar. But I mean, this way, if you ask about add-on checking, yes, we can make it in this way. Anyone having a question, also he can take the mic and ask. Or he can write it down in Q&A box.
Okay, we have one published question.
Okay. I will try to find it.
Okay, we have 4 questions already published.
Okay, so they said insulin is not break down the fasting, so this patient no, the long acting insulins, no need to be eat after that, so no need. The short acting insulin, that's he need, this is the time he need to to eat after that. Here, other question, which kind of food is better for suhoor time? Usually we told our patient, please, we don't prefer those very high carb diet. We prefer those with protein diet, more protein diet. Okay, so again, what's the best to monitor change of insulin before the meal or 2 hours after the meal? Both way can be. 2 hours after the meal for patient with diabetes should be less than 180. Those with before the meal should be less than 130. So 130 pre-meals and 2 hours should be less than 180. What about a patient in metformin and glycoside? Do you suggest give both of them at iftar time? The answer is yes. Both of them to be given at iftar time, no problem.
Okay, doctor, we have more 60 questions will be published right now.
Okay. Okay, it's good for patient type 1 diabetes user Novomix and Novorapid without Lantus. Actually, the best way to take the treatment for type 1 diabetes is a basal bolus. So as you know, Novomix is mixed between short acting and long acting insulin, and addition of the short acting in between. But the most important thing is talking long acting and short acting. We don't prefer Novomix in type 1 diabetes in general, and especially in month of Ramadan, because this will make the fluctuation of blood sugar. What's the best food choice for suhoor? As I told you, there is no, we prefer not eating meals in very high carb patients, because this will increase the blood sugar, shooting blood sugar. Before making the exercise, it's much to have a snack independent on glucose reading before exercise. Yes, better to have a snacks and check your blood sugar before and in between and after. They said if it's more than 300, why ask patient not fast? This is very important questions, because we are afraid that this patient will develop severely dehydration or diabetic ketoacidosis, and he will be admitted to the hospitals. If the patient on basal insulin and pre-meal short-acting insulin, what's your advice, please? We told you as in the lectures, please take the basal insulins at iftar time and make short-acting with the meals. And if the patient well controlled pre-Ramadan or having, very well controlled, you can decrease the basal 20 to 30%. Okay, what do you recommend to change insulin regimen from pre-mix to basal insulin during Ramadan? Yes, if the patient, before Ramadan, he's in pre-mixed, I prefer this patient, it will be in basal bolus better, regardless of his type of diabetes. Management of hyperglycemia during iftar time. Yes, if the patient shooting his blood sugar, we should adjust his medication at the same day and tomorrow to adjust. As I show you the slides, depend on the reading, you adjust the insulins and try to manage adding units of insulin or decreasing unit of insulins.
Okay, doctor, I have more 5 questions. It will be published right now.
Okay. What about Ozempic? Can you tell me about its users? The Ozempic, it's available in Saudi Arabia. It's semaglutide. Those they don't know this medication. It's semaglutide. It's GLP-1. It's once weekly medication, once per week taken. if the patient takes this medication, it's starts in Saudi Arabia maybe 1 month or 1.5 months before a month of Ramadan. If your patient on Ozempic, please don't titrate the dose. Try to use the same dose before a month of Ramadan and continue during month of Ramadan. Then after that, you can titrate it to upper maximum dose. As of today, we have better better solution for glucagon as hypoglycemia treatment. Yes, I mean, if your patient having severely hypoglycemia, try to help him with glucagon to prevent these situations. If my patient is on 500 twice daily metformin, can I give him 1 dose of 750 only during month of Ramadan? Yes. And as I told you, which time? It will be taking at iftar time. Rahaf, she said, is the GDM anti-diabetic medication adjustment are the same? I mean, the gestational diabetes, usually we don't give them medication unless they are in diet modification or in insulins. So we treat those patients according to the GDM characteristic. For example, we accept the fasting 95 and below, and 2-hour postprandial 130 and below, and we adjust the insulin medication accordingly. What about glucose level 70 in post-stroke patient? Did you suggest break down the fasting of 70 is acceptable? No, I mean, if the patient 70 or low, we told them please break down the fasting. It's very high risk to be lower, and it will having some other complications. Patient on type 2 diabetes on metformin, once at iftar, and linagliptin 5 milligram at iftar. His blood sugar always above 200. So what your advice? His hemoglobin A1C7. As I told you, hemoglobin A1C7 is not the key control because this is the mean. It's depend on the fluctuation of the blood sugar. So we ask those patients, please try to manage your diet as much as you can. And if you visit your doctor prior to month of Ramadan, try to adding another medication for them, or try to adjust their food meal, or during month of Ramadan, visit your doctor after you finish month of Ramadan to adjust your medications.
Okay, doctor, we have 4 more questions. I will publish it right now.
Okay. There is one question said, what is MPH? MPH, this is one of the basal insulins. It's old, actually, basal insulins. That wasn't previously. Nowadays, it's less be used. It's their work for 12 hours. Now we have long-acting insulin, basal insulins, and better than MPH that we used before. Okay, other question, if the patient type 2 diabetes on oral anti-diabetic medication and blood sugar 300 at 3 p.m., can this patient fast safely? Usually, I mean, as I told you, non-fasting hour, not like fasting hour. I know if his blood sugar is 300, we will ask him to drink a lot of waters and take extra correction dose of insulins, and as you know, he will be fasting soon. So the blood sugar, maybe it will go down. So yes, in fasting hour, he can save, but our recommendation, if not in non-fasting hour, 300 is safe, but in fasting hour, it will be difficult. Which is suitable time for Lantus and how much % to be reduced in Ramadan? The suitable time at iftar time, and the patient is well controlled, it's reduced by 30%. They said if the patient on basal and 3 doses boluses, we change boluses to 2 doses. Should we adjust the iftar dose or increase it and decrease the suhoor time by 20 to 30% if control, or twice dose and we only decrease the suhoor dose by 20 to 30%, decrease only the suhoor dose by 20 to 30% if this patient will control, and as you know, depend on the reading, the blood sugar it will be. If the patient is happy with continue his basal insulin pre-suhoor time, should we ask him to change it to iftar time? No, he can continue it, and continue blood sugar monitoring is the key point in this patient.
Okay, doctor, we have 2 more questions. Can we proceed?
Yeah, you can.
Okay.
Okay, Dr. Wright, thank you. If you can come, if the patient came with 500 glucophage TID, Tragenta once and Dimicron once, what to do? Usually, I told my patient to take 2 tablets of glucophage at iftar time and 1 tablet at suhoor. The Tragenta and Dimicron will be taking once daily at iftar time. Bariatric surgery for diabetic and fasting Ramadan. Actually, the bariatric surgery, no problem to fasting Ramadan, but some of them they will be cautious about the hypoglycemia, so they should frequently check their blood sugar monitoring during fasting of Ramadan.
Okay, until now we don't have any more question in the box. Do you like to wait?
No, we can.
Question?
If there is any question by voice, anybody can take the mic and ask.
Okay, sure. Okay, we have one more question. It will be published right now.
Patient,
Doctor,
okay. Patient insists to practice walk 1 hour before iftar. Is it correct and beneficial? To be honest with you, I talk about it before. There is limited study talking about exercise before, in fasting hours. As you know, we are in our area, we fasting 14 hours or above. So all study talking about making the exercise after fasting is 8 hours. There is no study talking about 14 hours. So is it beneficial? I think the risk is much way from the benefit. So the patient will develop risk of develop hypoglycemia, better than benefit. So he can delay it 2 hours after iftar. But if you're talking about non-diabetic patient, regular one, he can do it. Yes, he can do it, but we prefer it will be not severely exercise, very small exercise like small walk, and to be finished at iftar time. So this time will allow us to eat his iftar at shortly. And if he develop hypoglycemia, it will be calculated.
Okay, Doctor, we have more questions. Can we proceed?
Yes, we can.
Okay, it's publishing right now. Four more questions.
Okay. How the practice intranasal medication for hypoglycemia? This medication is not available in Saudi Arabia, and we didn't use it and we didn't have experience with it. I will be back to, there is some question maybe we don't answer. Yeah, if the patient taking the Lantus at night and in Ramadan he will take it at iftar time, yes, he can take it at iftar time. Many pregnant patients with diabetes are on Levemir and some on the Lantus. Is there any preference in Ramadan? Usually we, if we told our patient if she's pregnant on Lantus, she can safely continue in Lantus. But if there is initiation, for sure the Levemir is better. How? Yeah, we answered this question.
Okay, Doctor, we have more questions. It's publishing right now.
Okay. Type 1 diabetic patient need to take insulin bolus dose before snacks between iftar and short sahur. Actually, the basals, he's talking about basal, which will be taking at iftar time. The boluses, it will be taking with iftar and sahur. And if he take snacks, very high snacks and very high carbs, yes, he can add another one. How can I change from intermediate release metformin to extended release? It's easily. If your patient taking the immediate release, change it to extended release and taking at iftar time only. What to do if the blood sugar is 400 at midday of Ramadan? Midday, I think he talking about midday of fasting Ramadan. The answer, he should break down the fasting, drink a lot of waters, and take his insulin to correct this blood sugar reading.
We have more questions already published, Doctor.
Okay. We say the bolus, basal bolus, if it's linked only to insulin pump and what we other medication insulins. When we say basal and bolus, is it linked only to insulin pump? No, basal bolus is like insulin Lantus, and boluses we mean those Novorapid or human. It's not insulin. I mean, it's not a pump. The pump is the machine that to put the patient and giving basals, a lot of basal and bolus. It's all short-acting insulins. As you know, lots of patients want to eat more dates, and some of them suggest walk running after eating dates. Is it possible? Usually, we told our patient to take only allowed 2 to 3, dates only. Don't make it much more than this because, as you know, this will increase his risk. SGL2 and diuretic therapy for hypertension and heart failure. I think this question is very important. SGL2, we use it for to control the blood sugar, and diuretics, we use it for heart failure. Initiation of SGL2 during month of Ramadan, I'm not recommending. Usually initiated 2 to 4 weeks before month of Ramadan, and ask the cardiology if this is safe to be fasting Ramadan. If the patient developing dehydration, they should stop SGL2.
Okay, Doctor, we have more questions.
There is any herbal therapy like cinnamon can be taking? Yes, can be taking, and there is very studies suggestion that the cinnamon can help those diabetic patients. Yes, if the patient check the glucose at 1 p.m. and this is 290, he can continue fasting. It's, as you know, it's not cut in the medicine. It's not cut point. We mean 290 and less than 300. Yes, he can continue, and frequent monitoring. If he reaching 300, he will break down. If not, he can continue. It's okay to children to fast. Yes, it's okay for children to fast, but if they are diabetes, no, it's not. It's, because most of the children having type 1 diabetes, we don't recommend them to fast. SGL2 and diuretics, we answered this question before.
Okay, Doctor, we have more questions shown here. Patient, okay.
Okay, so when did we recommend patient to go to ER if hypoglycemia? If the patient having symptomatic hypoglycemia and he decreased level of consciousness and he cannot take anything by his mouth and you cannot help him and you don't have a glucagon injection, we advise you to take the patient to emergency room. Type 2 diabetes and liraglutide for lower weighting for morbid obese patient. If the patient start this liraglutide 4 weeks before month Ramadan and he's continuing it, yes, he can continue liraglutide. If this patient having severe symptom of GI upset like vomitings and other symptoms, we can stop it.
Okay, more questions?
If the patient checked the blood sugar at 9 a.m. and found to have 80 and having symptom of hypoglycemia as sweating threat, can he break down the fasting? The answer is yes. It's not only numbers, it's the symptoms also. What about glucose 17 post? Yeah, we answered these questions. Yes, he should break down the fasting. Those patients in oral hyperglycemic agent, can we recommend them to do SMPG or no need? If those patients low or middle risk, yes, we recommend, but it's not like those patients in MDI or multiple dose injections. We recommend them 1 to 2 per day. But for those on insulin, we recommend them to do frequent blood sugar monitoring.
More question published, Doctor.
What's about glucose levels? Yeah, we answered this question. He asked it many times. Is there any recommendation about having snacks between iftar and suhoor? Here in Tunisia, we are fasting more than 17 hours. First of all, I want to thank this doctor. He joined us from Tunisia, from Tunis. So I want to say for him, Ramadan Kareem. And I hope you safe Ramadan. You are safe to fast Ramadan. We are in Saudi Arabia having 14 hours. So in Tunisia, you have 17 hours, and this is, this is very long. I remember when I am studying abroad in Canada, we are fasting maybe 18 hours, and it was very, to be honest with you, very tough to fast Ramadan. So your question, any recommendation about having snack between iftar and suhoor? Yes, I recommend to have snacks between iftar and suhoor, but I know it's very short time because I tried this experience before. It's only 7 hours between iftar and suhoor. So I recommend those patients fasting in Tunisia or country like this to take the iftar as fast as they can from adhan and delay the suhoor as much as they can to make it 30 minutes before Fajr prayer and make a meal in between just to make a balance between the 3 meals. What about Novomix?
Doctor, I think.
Yeah. What about Novomix 50?
Sorry, Doctor, continue.
Yeah. What about Novomix 50? It's better to change in Ramadan due to risk of hypoglycemia. No, the MDI is better. But if you want to do the change, do it before Ramadan. If he's already in Novomix 50, continue in Novomix 50. Because the problem if mixed in generals, the blood sugar will be up and down, as I show you in one of my presentation slides. If blood sugar more than 300, should the patient go to ER or to exclude ketones? If the patient in type 1 diabetes, maybe yes, but if type 2, and depending on the symptom, if the patient symptomatic, yes, he can go to ER. If not symptomatic, drink a lot of waters, take his insulins, and it will come down.
More question published, Doctor. Hello, Doctor. Everything is fine with you?
No, it's not showing for me here. I don't know why, but I will check. Okay. Yeah, let me go up. Yeah, does that mean the most impact to blood sugar and the fasting in it, and should we cut them in Ramadan? Does the meat has most impact to blood sugar and the fat in it? No, I mean the protein diet is not the problem. Usually, the very high carb diet is the problem. The meat, yes, the patient can eat meat. It's for diabetes is not a problem.
One more question is published, Doctor.
Okay. Okay, best time for liraglutide in Ramadan. The best time in liraglutide in Ramadan at iftar time.
Okay, Doctor, we have a lot of messages for you to thank you for your course.
Okay.
Many messages. If you would like to publish it,
Yeah.
it's many actually.
Yeah.
They
So yeah, I tried to read it. They said they most of them they said thank you so much for your lecture. Some of one he said Dr. Muhammad Hassanain study during month of Ramadan. Where to find it? It's just write in Google DAR study. It will be shown. They are some of them they ask about attendees. The register with us today more than 900, almost 900, and the seat is closed, so we cannot give more to attend. MashaAllah, tabarakallah, we have a lot of people, even from outside Kingdom, from Tunisia and other countries, they attend with us today. And in this, at the end of this lecture, I want to thank the post-grad people to arrange. I want to thank the National Guard as an institution to allow us to talk to the doctors and we meet them in very tough situation of COVID-19. I want to special thank to Dr. Ali Zawawi and for our manager today and Salman to arranging this event. I want to thank you attendees today, more than 900 attending with us, and if we open more, this 900 is first of all we open 600 seats. It's almost full within couple of hours. Then we exceeded another 300 seats. It's full also after a couple of hours opening. So Ramadan Kareem for everybody and happy Eid in advance. I want to thank you everybody attending with us today and sharing information, sharing the questions, sharing the ideas about management of type 2 of management of diabetes during month of Ramadan. I want to thank also COVID-19 to facilitate for us the lectures, the lecture, symposium, conference, virtually that meeting the people. So now we have giving the lecture, meeting the people worldwide in any place and every area in the world. Thank you so much for all, for everybody today.
thank you so much. Thank you so much, Dr. Raed. Thank you.
Thank you.
Appreciate for this amazing course. And for the attendees, I just announced the link for the attendance. Please check the attendance link and register your attendance for today. If you face any problem with your check-in, please let us know. I will be here for you, and inshallah, everybody can get his or her attendance for this course. The CME hours, inshallah, and the certificate will be ready within 10 working days. Your CME hours will be added in your Mubaris account within 10 working days, inshallah. For any question, for any issues with the link or with your certificate or with your CME hours, please don't hesitate to contact us through the email and in the poster. So Thanks. It is opening on laptop. Great. Great to hear that. Nice. Alhamdulillah. Greetings, doctors. What is your take using? Actually, I'm sorry to inform you that doctor is already left. So you can contact him through his email, personal email or his work email to answer your question, Mr. Abdul Muhsin Al-Qurashi. I'm sorry for that. Okay, object reference not set an instance or an object. Okay, this is message said that your ID number is not correct. Please make sure that your ID number is correct, that you can put it in the page. ايش الحساب في تويتر؟ BTC sorry postgraduate BTC. Yes, it is work. Thank you. Great, Madawi. Great. Thank you. Send me the link. Okay, Abdullah Shihri, this is the link. I send it to you right now. Please copy it and put it in your Google Chrome browser. It will work with you. Can I reply my information through email which I received? No, you cannot reply that email because it's from the system. Just send it to our email, our center email. Sir, how to do the attendance link? Link is not opening. Okay, you can copy it and put it in your Google Chrome browser. It will work with you. Sir, I was able to open the link that you have given and type in the ID number and it showed welcome and thank you for attending. Does it mean successful? Yes, congrats. It's work. I'm happy to read that. Okay, I did the shorter link in Safari and it's already confirmed my attendance. Great, thank you. Can you help me please? Reem, what kind of help do you need? Let me know. I can access the link, attendance link. Thank you, gonna ID number. Oh, okay. Did you try to copy the link and put it? I will send it to you again. Please try to copy it and put it in your Google Chrome browser. How to write my ID? Please check the email that we sent to you after your registration. You will find your ID number in the same email. Use this ID number and put it in your attendance link. Okay, any more questions? This is my email. Reem, I will send the link again to you. Please you copy it and put it in your browser, Google Chrome browser. Okay, we have also new message here. Okay, Reem, did you try to copy the link and put it in your Google Chrome browser? Could you please help me in that, please, Reem? اوكي مهند، حطيت الاي دي ويطلع لي، معناته ان الاي دي اللي حطيته يا الغالي غلط. Please make sure about your ID number. Okay, any more question? Okay, I have a question regarding fruits for diabetic, please. Sorry, I'm so sorry. The doctor is already left. So you can, I will just put your email, or you can contact, you can contact the doctor through his personal email. ريم 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 ممكن تكتبي معلوماتك كاملة في one box please. مهند المشكلة كانت انه لازم تكتبه مو تنسخه وتلصقه. خلاص طلع ولك welcome. Okay, this is another recommendation. Muhammad here said that you have to write it, not copy it, and it's work with him. Great to know that. شكرا مهند. It is okay. Any scientific question, please. I cannot answer it because the doctor is not anymore here. He's already left. I'm sorry for that. You can contact the speaker through his personal email. ريم حاولي تكتبين اللينك كتابة. I think it will work with you. Better to replace it to complex like others or not. Oh, I'm sorry. Any scientific questions, I cannot answer it. Dr. Wright is already left, so link not working. Please confirm my attendance, please. Okay, did you try to copy it and put it in your Google Chrome? Or please write the link in your Google Chrome or open it in your laptop. It will work inshallah with you. I will put the link again for you in private. مهند سؤال الآن بعد ما كتبت الاي دي وتأكد حضوري وش الخطوة الثانية؟ أول شيء شكرا لك، كويس إن تأكد حضورك. الخطوة الثانية إن شاء الله within 10 working days or 5 working days اتبع الخطوات اللي موجودة في حسابنا في تويتر. راح تلقى خطوات how you can get your certificate and how you can evaluate the course. إن شاء الله everything will be fine with you مهند. Greeting doctors, what is your take on using sorry, this is a scientific question, I cannot answer it. اوكي ريم وش صار معك؟ جربت بكروم بعد ما زبط معي. اوكي طيب يا ريم اكتبي معلوماتك كاملة، ايميلك، your ID number اللي ارسلنا لك بعد ما سجلتي، وايميلك، وان شاء الله باذن الله راح ارسل القسم الاي تي يحلوا لك الموضوع. Sir, I was able to open the link that you have given and type in the ID number and it showed welcome and thank you for attending. Does it mean successful? Yes, it's successful. Alhamdulillah. الساعات تنزل في حساب الهيئة. Yes, الساعات إن شاء الله راح تنزل في حسابك خلال 10 أيام عمل بإذن الله. All the CME hours will be added to your account inshallah within 10 working days. Any more question? I copied the link but it didn't work. Please send me the certificate by email. I cannot send the certificate to you by email unless you have to fill the evaluation form. So my recommendation to you, try to open the link in your PC or your laptop and it will work with you, or copy the link and put it in your browser. If all these steps is not working for you, please write all your information in the box right now. Your name, your email and the ID number that we sent to you after your registration. Any more question? اوكي ما اقدر ادخل. اذا ما تقدر تدخل الرابط انسخه وافتحه عن طريق كمبيوترك او عن طريق اللابتوب، ان شاء الله راح يفتح معك. اذا ما فتح معك وحاولت انك برضو تنسخ الرابط وتحطه في جوجل كروم براوزر وبرضو ما اشتغل معاك، please write all your information, your email address and your name and also your ID number that we sent to you after your registration. اوكي ريم، خلاص بالله اكتبي يور انفورميشن كامله. حساب تويتر بالله وسوري على الازعاج. حساب تويتر I will write it for you. اكتب بس مركز تدريب الدراسات العليا راح يطلع لك ان شاء الله باذن الله. I will announce my I will make announcement right now for all of you with the postgraduate training center account. Just wait a moment. I'm on Twitter right now. Okay, this is our account for our postgraduate TC. This is our account and Twitter, and also my account in Twitter is Salman Al-Muaili, at Salman Al-Muaili. I will write also, I publish the I will announce also the email address of our center so you can use it for any query or question or follow up. BTC registration at King Third University for Health Sciences .edu.sa. اوكي thanks it's work. حلو ممتاز excellent. ريم تمام ايش ضبط معاك؟ ان شاء الله يا رب ضبط. عن طريق اللابتوب تو ضبط، الجوال ما ضبط. ممتاز يعني يا شباب يا بنات، على اللابتوب يشتغل معكم ان شاء الله. اذا قال لي تم الحضور، ايش الخطوة الجاية؟ هل راح ترسلونها على الايميل ولا بتويتر راح تكون؟ خلاص انت سجلت حضورك الان. ادخل على حسابنا في تويتر راح تلقى كل الخطوات والستبس موجودة هناك. how you can get your certificate وكيف تعبي الكورس evaluation عشان تحصل على الشهادة. Sir, I really cannot opening the attendance link. ID number is 13726. Okay, no problem. All your information will be sent to the IT inshallah. My email ريم اوكي شكرا يا ريم، شكرا يا ريم. ان شاء الله نحل مشكلتك باذن الله. My email okay eurobim@gmail.com. Please write all your information, your name, email address, and also your ID number that we sent to you after your registration. والله كتبتها ما نسخت برضو ما زبط. ما يهمك يا ريم، ان شاء الله everything will be fine. Any more questions? Any more questions? ما شفت الخطوات الله يعطيك العافية بتويتر. موجودة في الصفحة بارك الله فيك. ادخل وابحث عنها راح تلقاها موجودة تحت. كل الخطوات موجودة، التسجيل، الشهادات، الايفالويشن كلها موجودة. إذا ما لقيتها راسلنا على الإيميل وراح نرسلها لك إن شاء الله كاملة. يجيني إيميل إذا انحلت المشكلة. ريم تابعي معنا على الإيميل اللي أنا سويت له بابلشت قبل شوي. ان شاء الله راح تنحل مشكلتك، ما يهمك. دخلت تويتر ما في الخطوات، ما لقيت تعبئة الاستبيان عشان الشهادة. هي موجودة، أنا متأكد أنها موجودة، بس ممكن في بوستات قبلها، لكن لو تنزل تحت راح تحصلها. حتى لو ما حصلتها راسلنا يا مهند على الإيميل، راح نرسلها لك كاملة بإذن الله. Any more questions? باقي 52 attendance. 52 attendance are still here. Do you have any problem? Please let me know before I close the session. Okay. I tried to register but unable even. I copy the link. Can you please help me register attendance? Sure, I am here to help you. Inshallah, I will help you. I will send all your information to the IT department and it will be solved. Yeah. أوما. أوكي. هل قصدك الخطوات منزلة تحت بوست المحاضرة أو من قبل؟ إيه، تحت بوست المحاضرة من قبل. راح تحصلها. ما ضبطت، رديت على كلامك. طيب، ما في مشكلة. ما عندك أي مشكلة يا ريم. إن شاء الله everything will be fine بإذن الله. Don't worry. Okay, good evening, sir. After I entered my ID number, this one appear new course with ID number does not exist. What do I need to do? I think your ID number is not correct. Please make sure about your ID number. Okay, G9. Thanks to provide me with your information. Okay, thank you. Thank you. I see your email right now. What about the others? What about the other 46 attendees who are still here? Do you have any problem? Please, I don't want to close the session without helping you. So please let me know if you have any problem. Noor, okay, Noor. I am sending it through events, KSAU attendance noted. Okay, it's work with you? Okay, great. Noor. Noor, it's working with you. آسف أخوي على الإزعاج بس ما شفت الخطوات تحت البوست. مو مشكلة، راسلينا على الإيميل وراح نرسلها لك كاملة بإذن الله. او تحصلينها برضو in my account in Twitter. اوكي ريم finally الحمد لله خلصت مشكلتك. great. اوكي حاولت تو من جديد وضبطت الحمد لله. الحمد لله good to know that. الحمد لله. هل ممكن اتواصل عن طريق الايميل ترسلوا لي الطريقة؟ يس شور راسلنا عن طريق الايميل. شوف الايميل نسوي له بابلشت او راح تحصله في البوستر حق الكورس، او تدخل عن طريق جوجل وتكتب any information about our center راح تلقاها. ممتاز. اشوف كثير اللي عندهم مشاكل انحلت الحمد لله. this is good. this is good. So it's already 12 right now and we have still 40 attendees. Please let me know if you have any problem or issue before I close the session. Hello. Okay, Noor. Noor, it's my ID attendance 81733. Okay, great. Thank you. Okay. I think we are done here. I will give you 5 minutes more, then I will close the session. I will contact the IT department so I can collect all your information.